This is the third annual Northside Community Health Fair and Free Food Giveaway. This virtual presentation is brought to you by the Northside Coalition of Jacksonville. Northside, say it loud and say it proud. The theme of this year's event is Your Health Matters. This presentation is brought to you by generous grants provided by Clear Health Alliance and by Florida Blue, a GuideWell company. We're leading efforts to support people and communities across the state and to protect the safety and stability of our health care system. You can count on us to lead the charge during challenging times and to build healthier communities when it matters most. Your health matters. Florida Blue and you. We're in this together. Our focus this year is on healthy eating habits and on mental health. Our theme this year is Your Health Matters. We welcome you now to the third annual Northside Community Health Fair.
And good afternoon to you, and especially you. Hello, everybody. I'm Ben Frazier. I'm excited today. We had a very successful free food giveaway at the Clandale Brown Community Center. We actually reached out and touched about 500 households. Absolutely unbelievable, far beyond even our own positive expectations. Again, I'm Ben Frazier, the founder, president of the Northside Coalition of Jacksonville, your host for this presentation. And the main point that we want to make today is this: your health matters. Health is, of course, a complete physical, mental, and social well-being. Better health is obviously central to human happiness. And of course, when it comes to health, most of us want to feel better in terms of physical, mental, and emotional quality of life. Of course, most of us want to live longer as well. Our panelists are here with us today. They're going to tell you that health is wealth. Wells Todd will tell you that health is a state of complete harmony of the body, mind, and spirit. I'd like to thank you for joining us today, Mr. Todd. Mr. Todd is a retired social worker. He's lived to help many others who are challenged with mental problems. He's also a longtime activist who's fighting for the needs of the community. He's a leader of the Jacksonville Progressive Coalition and Taking Down Jacks. Wells Todd is also a very good friend of mine. Again, welcome aboard, Mr. Todd.
Thank you for having me here, Ben.
Why, of course. Tarika Nelson. She is the very popular entrepreneur, owner of the T-Posh restaurant, a vegetarian vegan eatery here in Jacksonville, Florida. And of course, she's going to tell us that to ensure good health, that you should eat lightly, breathe deeply, and of course, live moderately. You need to cultivate cheerfulness and of course, maintain an interest in life. Tarika Nelson, welcome aboard for this presentation today.
Thank you.
Linda Jones. Linda Jones has been a social service counselor with the Healthy Start program. We want to find out a little bit more about that program today. She's been with the Department of Health of Jacksonville since 2014, became a team leader in July 2020, currently assists with the training of new employees participating in outreach programs held within the community. Ms. Jones will tell you today that you can't control what goes on the outside, but you can control what goes on inside. Belinda Jones, welcome aboard.
Thank you so much.
Why, of course, we're glad to have you.
Thank you.
And our other panelist, Jeharman Lieberman. Hello there. How are you? Jeharman is a mental health counselor at Harvest Intervention, a business which, by the way, she founded. And she will tell you today that in the words of Mahatma Gandhi, it is health that is the real wealth and not pieces of gold and silver. We welcome you, Ms. Lieberman.
Thank you.
We're very happy to have you, and we welcome you all aboard to this virtual presentation, which we've titled Your Health Matters. Holistic health, that's what we want to talk about today, panel. What we mean, of course, is the picture of health that includes not only the obvious physical factors, but mental, emotional, social, and even spiritual factors as well. And sometimes when we deal with professionals, well, Todd, of the medical science realm, the system actually separates different facets of health, and there seems to be no crossover guidance, no framework for fitting all those different pieces together as a whole. In today's modern world, many of our systems and our customs seem to be, in my estimation, organized in a way that separates these various facets of health. For example, a nutritionist might recommend ways to eat healthily. A therapist might recommend ways to cope with stress. But often there is no crossover guidance, no framework. So I'm suggesting that health encompasses not only the absence of physical disease, but involves healthy habits, healthy thoughts, for example, coping mechanisms, peaceful ways of relating to your environment, peaceful ways of relating to everybody around you. So today on this program, we're committed to the vision of holistic health. The various parts, I suggest, cannot be separated from the whole. Mental, emotional, social, and even spiritual factors are part of the whole. Our journey today is a journey to a well-balanced life. And again, welcome to Your Health Matters. Now, let's get started here with the questions about nutrition. Okay, panel, let's talk about good nutrition. I suggest that it's combined with physical activity. The question then becomes, how important a part is good nutrition to leading a healthy lifestyle? You can wave your hand and your producer will put you on if you'd like to answer that question first. How important a part is good nutrition to leading a healthy lifestyle? Jeharman?
Okay, I can definitely answer. I didn't see how to raise my hand on here, though.
Okay.
Okay, go ahead, Tarika.
Okay, no worries. Well, that's a very good question to start with, because what I've noticed in even my own lifestyle transition and eating more healthier, learning more about the African biomineral balance, is your health, it determines your success. It determines your livelihood. It determines your state of mind. It determines your ability to be able to succeed and also start the initiatives that you have for yourself, whether you want to open a business, if there's a hobby that you want to, monetize, you need the energy to be able to do that. Your mind needs to be clear, and you need to be inspired. In order for you to be inspired, you can't do that if your body is weighed down with illness, if you're worried about being too tired, if you're worried about a certain illness and having and going back and forth to the doctor, then that's taking up space from you being able to develop who you really are, and most importantly, develop some of the things that the world may need from you. So in order to really be the most successful that you can do, you want to be in a more healthier state. And I'm speaking from experience. Okay. Many years I was weighed down with a lot of illness, and a lot of the things that I'm doing right now, I never knew that I had all of this inside of me until I reached a state of health.
Wow. So then that sort of explains, in terms of your own personal testimony, why healthy eating habits are so important. Anybody else want to weigh in on that? Go ahead, Mr. Wellstott.
Yeah, I just want to follow up on that. Very good points. I think what we as African Americans are learning more and more, and I go back, way back to the 60s when we started to understand that our nutritional needs were much different in Africa. And when we were brought over here, our whole physical and mental system was basically broken down. And we suffer from many different illnesses due to the change in diets, due to the oppression and exploitation that we have experienced and continue to experience. In the Black diaspora, coming out of Africa, we are saddled with Western medicine, Western ways of curing illnesses, where in Africa it was a holistic approach.
Yes.
I remember back in the 60s in New York, where I was born and raised, when, and this is not to disparage anybody, but, we had, all of a sudden we had soul food restaurants pop up. Well, a lot of that soul food was what was giving us heart attacks. But they were a big fad at that time. And over the years, though, over the decades, we begin to understand that that so-called nutritionally based pyramid that is out there that we see that they tell us is true is not true for us. So we have to take a totally different approach to our physical and our mental health. Once again, I have to stress this, and that especially in the times that we are in now, it is very important for our physical body to be healthy.
Yeah.
Because if it's not, our mental state will be fogged, so to speak. And so I'll just let other people speak on that, but I just wanted to follow up on what Sposh was saying, because it's very important.
Yes, and I want to allow Ms. Lieberman a chance to speak, but I do want to mention just very briefly in passing about the tremendous healthcare disparities between Black folks and white folks here in the United States. We all know that there is a tremendous prevalence on the part of African Americans for diabetes, strokes, heart problems, kidney problems. And so much of this is traceable to political policies as well. We'll get into that later. But let's talk first with Ms. Lieberman about the need to deal with healthy eating habits and the role that they play in the quality of our lives and just how long we live. Ms. Lieberman.
I'm sorry, it's Ms. Leitner. But thank you so much. I just believe that, again, we have to become aware of what is healthy for our bodies, taking personal accountability for finding out how our bodies respond to certain foods, because it may not necessarily be an unhealthy food per se, but it may not be the best for you to operate at your maximum. And I just want to highlight that children, their diets are very important as they are developing. The healthier the fats are, the healthier the foods are, the better their brains function, the more energy that they have. And so we have to be mindful of that again when we're shopping. Be aware of what we're taking in, and do things in moderation. A lot of junk food, it's not good for kids. It could have an adverse effect of them feeling sluggish and not being able to focus and learn when they have to have enough energy to get them through the day. So just being mindful of that, and knowing that over long periods of time, that could affect them, again, their minds and their performance, which again can lead to other physical problems because we're not motivated to even exercise, or motivated to make those healthy choices.
Now, allow me, please, if we could, to get into some specifics. Wells Todd mentioned something about soul food. I think it's time for us to have an upfront, honest conversation about some of the foods that we're consuming and whether they're good or bad for us. I think it's time for us to be upfront and start telling people what not to eat, because it's not in their own best interest. Now, you talked, for example, Ms. Leitner, about junk food. Why don't we just start there about junk foods that we're giving kids that perhaps we should not be giving them? Go ahead, run that list down, and then let's go back to Ms. Nelson at the Teapot and Ms. Jones, who deals with kids in Healthy Start program. Let's talk about these foods, because I'm concerned that we are clogging our arteries and shortening our lives by the foods that we eat and the preparation that we use. Go ahead, Ms. Leitner. Junk foods?
Yes, junk foods. Junk foods have a lot of high fructose corn syrup, high in sugar, so not a lot of healthy content. And again, we need to be mindful of making sure that our kids are having those healthy fats and healthy fruits and vegetables.
Very good, very good. And Ms. Nelson, if you would, let's talk about soul food. Okay, now, well, most of us who grew up in the South, we're familiar with comfort foods, and we like a lot of things that I'm convinced have been killing us off. And I think that it is time, perhaps on this program, for us to honestly address the issue of what it is we're eating. Some of us like sandwiches clogged with mayonnaise. Some of us like all kinds of sugar. Some of us like all kinds of salt. Some of us like all kinds of flesh, that pig I'm talking about. Some things that are clearly not in our own best interest. Why do we keep eating it, Ms. Nelson? And what do we need to do to address this issue honestly and straightforwardly? What do you have to tell predominantly Black folks what they're doing to themselves by consuming foods like this that are prepared in different ways? Go ahead, you have the floor. I don't know whether we can hear Ms. Nelson, if we can get her mic
on. I'm sorry, I didn't turn the mic off. I'm sorry, it's all. Can you hear me now?
Yes, go ahead.
Okay, great. So yeah, I definitely think I'm glad that you're allowing me to express that part, because that's a big part of what I do, is educate individuals on what's happening to us and how we can get out of it. But my first initial PSA is for the children. In regards to what Ms. Leitner is saying, I can tell you this, please, my people, do not allow your children to eat those hot Cheetos, the hot chips, the flaming hots. Every child or family member that I've had to consult or assist that had a terminal illness in their 20s, in their 30s, and sometimes even younger, I always ask that one question first. Does the child eat the hot chips or, the flaming chips? Oh, yes, they love it, eat it all the time. That hot and that acid. So the chemicals that they make to make the spice in those chips is literally full of acid, and that acid is pretty much burning the organs inside of their body. And it's depleting it all the time. For their little kids, they're eating it. The acid is like burning out their organs, especially with their digestive system. So what is happening is, this is why we see a lot of children that are, in their late teens or mid 20s that are dealing with a lot of terminal illnesses. And that's always the common question that I ask, do they eat those hot chips? So even in my home and in my business, you can't come and Teapot those chips, because I'm going to take them from you, because I know the detriment that is happening in your body with eating those chips. So please, parents, and I do have a lot of people that will say, I'm on this journey and I want to eat healthy, but you're still going to the grocery stores and buying your children the acid-based foods, the processed foods that is going to put the children in the same predicament that you're in, that you're trying to prevent yourself from at that time. So if you're going to go into this lifestyle, the most important thing that you do is start it, learn as much as you need, but immediately implement that to your children. Because if you're dealing with that illness, then more than likely your children is going to deal with that same illness, which goes back to what Mr. Todd has said. That is the perfect example of what I consult with at T-Posh Naturals. Just think about it. When our ancestors came over, were sent over from Africa, the masters did not bring their food with them. They gave them the junk. They gave them the garbage. Now, because Black and more people, our brain capacity and the size of our brain is 10% higher than most other races. So this is how we're able to absolutely go into, I'm sorry about that. This is how we're able to absolutely get into a situation where we kind of get used to eating these foods that's not conducive for us. We don't know what our food is. And because we're eating this junk, what our ancestors have done is basically have taken the food and created a way to make a delicacy that they had actually enjoyed. But those foods are not conducive for our bodies. Think about it. Our ancestors come from Africa. It is a tropical climate. So the people that live in Africa, let's say the gorilla, not even people, let's say gorillas. Gorillas eat berries. They eat bananas. They don't eat meat. Elephants do not eat meat. Giraffes do not eat meat. And they eat the foods based on their climate, where they are from. Now, if you think about the polar bear that lives in the cold part of the world, they have to eat meat, because when they're eating meat, that meat sits in the body, it doesn't digest right away, and it coats their organs so they can sustain the weather. Now, imagine you take the gorilla and you put the gorilla where the polar bear is, and then the gorilla is then forced to eat the food of the polar bear, because the gorilla's food is not growing in that type of climate. And then the life expectancy of the gorilla is cut short. And that's exactly what we are experiencing as a people. We don't know what our food is, but our food is natural, God's nature's natural foods that naturally come from the earth, that have seeds, that will provide minerals to the body to allow the body to heal itself and produce healness, so the body can heal itself. The body is made to heal itself. We just have to learn how to put the body in a position to do so that way we can live our ultimate life.
Thank you. Now let's talk to Belinda Jones about the Healthy Start program. And Ms. Jones, please feel free to weigh in on any of these subjects that we have passed so far. Belinda Jones, go ahead.
I'm having some audio issues. So basically with the Healthy Start program, I work with pregnant moms. It's very important. So it's not that they're just, the mom has to care for her and the baby. So if we ask the mom to maintain a 300 calorie diet, plenty of fruits and water, drink plenty of fruits and vegetables, drink plenty of water to avoid dehydration. If she's not eating properly, we educate her on during the pregnancy that things like gestational diabetes might occur. If she's not eating properly, it could cause some brain development or help some type of birth weight defects and things like that. So basically just trying to educate the mom on eating healthy, not just for herself or the baby. So with, everyone knows, even with us, you're just pregnant moms, we have to eat to maintain the diet so we can avoid fatigue and other problems like heart disease, high blood pressure, high cholesterol, and things like that. So try to recommend to try to exercise. A lot of people, I know I don't like the gym. So I try to at least walk anywhere from 2 to 3 times a week to try to exercise, and it helps out. Even if you take about 15 or 30 minutes, a day, maybe 15 minutes. I need to know sometimes I might get away from my desk and just walk around the building a couple of times. So, that plays a big role, because I know we love collard greens and pigtails and all that good stuff. But, at the end of the day, it's a lot of stuff comes from hereditary with our families as well. I know a lot of diabetes and high blood pressure and stuff running in my family as well. So I try to work on eating a healthy diet and then educating when I go out in the community for, to avoid any health issues.
Very, very good. And I think it's very interesting that you mentioned about what it is we're eating. For example, fried foods. So many people that I know, including myself, we love fried chicken, we love fried fish. And I'm telling you that clearly that plays a role in clogging our arteries and running our cholesterol up. But let's take a turn and put it on a personal uh, point here with regards to how you're raising your children and what it is you're feeding your children. Wells Todd is a person that I know. He's a friend of mine, and he tends to be a person who is kind of careful about what it is he eats. But now tell me, Mr. Todd, you raised a young boy and he turned into a man. And what were you feeding him, and did it impact on him in a positive way in terms of his eating habits? Did you give him the right foods when he was coming up? And if so, what was it like? Did he like them? And after he grew up, did he stay with the habit of eating healthy foods? That's an honest question. And I don't want you to feel like I'm putting you on the spot, but to whatever extent you feel like answering that question, go ahead.
No, his mother and I, my wife, were very conscious of what we put in his body, what we allowed him to put in his body. We kept him away from sugary sodas and juices. We kept him away from McDonald's and Burger King. And we basically had home cooked meal, which we still have now. He's out on his own. As a matter of fact, he's the one helping us today. What I realized early on, which we all have realized this, is that addictions just don't come with drugs. Addictions just don't come with alcohol. We are addicted to the foods that we eat. And the earlier we are started on those foods, the harder it is to get off of those foods. And so sugar, fat, salt, and all of those things are put into processed foods. All of those things are put into fish fillet, McDonald's, Burger King, you name it, it's in there, in the food. And so, and I'll give you an example. His best friend, we lived 17 years in Kansas City, Missouri, and he grew up side by side with this guy. This guy lived up the street from a McDonald's. And he was at McDonald's 2 or 3 times a day.
Okay.
And that boy developed migraines. Okay. And we kept telling him, you got to stop eating those burgers, man, and those French fries. I mean, every once in a while, it's okay if you got to do that. If you're on the road somewhere, you're driving, you got to stop. We call them, roadside restaurants. But not on a daily basis. And that's what's happened to our community. And another point is the economics of our community. When you are living in poverty and you have $1.50 and it's dinner time and that's all you have, you're going to run into McDonald's, you see. And so the economic structure of our country, we have to understand, we have to deal with, because that is an essential part of what's killing us. Whether it be the economics of the food that we can afford, or the economics of not having health care, or the economics of not being able to provide mental health services for our people. So all of those things, fall in line with one another, and we have to be very understanding and conscious of what's happening in this country today. Those things are being assaulted and attacked in a way that they haven't been in the past 50 years. And we're going to have to start organizing more around this struggle for equality and justice when it comes to our children's health, when it comes to our elderly folks like myself, our health and well-being. And so we have to set ourselves on a path of renewal at this point. I've never been to your restaurant, but I'm definitely coming.
Okay.
Okay. We will be there.
Thank you so much.
Absolutely. We can't wait to see you come home.
And Wells, I wanted to mention in closing with regards to our conversation about nutrition, that we cannot be absent from the fact that these healthcare disparities can all be traced to political policies. And that's something that we should not overlook. But we have to grab the bull by the horns, Ms. Leitner, I think, and begin to take control of our own diets and our own healthy habits. We've got to start doing something different. You've got to start exercising. You cannot continue to consume all these salts, these sugars, artificial sweeteners, and all these things that you know are harmful to your body. I suggest it is time for us all, in the words of Wells Todd, there's time for a renaissance, a time of renewal, time for us to review and evaluate, use some critical thinking here with regards to what it is we're eating, how much of it we're eating, and its preparation thereof. We're going to come back and talk about the challenges of mental health and the Black community in just a moment. But for this portion of our program, I just want to thank you guys for addressing the issue of nutrition. We're suggesting to you right now that your health matters. We'll be back in just a moment with more. Don't you dare go away.
This is the third annual Northside Community Health Fair and Free Food Giveaway. This virtual presentation is brought to you by the Northside Coalition of Jacksonville. Northside, say it loud and say it proud. The theme of this year's event is Your Health Matters. This presentation is brought to you by generous grants provided by Clear Health Alliance. For the past 10 years, we've been helping members living with HIV and AIDS get access to the care and services that will help them the most. And by Florida Blue, a GuideWell company. We're leading efforts to support people and communities across the state and to protect the safety and stability of our health care system. You can count on us to lead the charge during challenging times and to build healthier communities when it matters most. Your health matters. Florida Blue and you. We're in this together. Our focus this year is on healthy eating habits and on mental health. Our theme this year is Your Health Matters. We welcome you now to the third annual Northside Community Health Fair.
Hello, and welcome back to Your Health Matters. We have a distinguished panel discussing the issues of mental health and nutrition today. On board, we have Wells Todd, a local activist here in Jacksonville, Florida, a social worker retired. He's worked a lot with prisoners in various prisons and jails across the United States and has witnessed firsthand the problems and challenges that people have regarding mental health. We also have on board Tarika Nelson, who is with the Teeth Posh Restaurant, the owner-entrepreneur there. And as we mentioned to you before, that this has to do with one's complete physical, mental, and social well-being. We're taking the holistic approach to how we even discuss this matter of good health. We got Jaharman Leitner with us, and she has her own business. She's a mental health counselor at Harvest Interventions, a business which she founded. And we certainly listen to what you have to say with regards to the sort of problems and issues that people have regarding mental health. Of course, we have Belinda Jones, who's also with us. She's a social service counselor at Healthy Start, and that is a part of the Duval County Department of Health, at least here in Jacksonville, Florida. So then let's get into this, guys. Mental health. Here in Jacksonville, local organization, the Jacksonville Community Action Committee, the NAACP, Northside Coalition, and a coalition of 24 other organizations, Women's March, others, tried to get the Jacksonville City Council to increase funding for mental health. They didn't do it. They didn't get it. Now, so that understandably, what we're talking about here is the push for human rights and civil rights as it relates to fiscal matters. So then, the point that I'm trying to make here, guys, is that despite the victories in the ongoing fight for social, racial, and economic justice, true justice among the Black community will remain incomplete until mental health disparities among this group are honestly and straightforwardly addressed. Mental health is an essential part of our overall health. So let's talk about the research for a moment, Ms. Leitner. Research suggests that the adult Black community is 20% more likely to experience serious mental health problems, such as major depressive disorder. Okay, so then the Black community suffers from an increased rate of mental health concerns, including anxiety and depression. My question to each of you, and I want you all to weigh in, is, does that really surprise you?
No, it's definitely not surprising when we know that the Black community deals with, like you mentioned, the social injustices that exist. I mean, it's not just our personal. Everyone has their own personal issues that they have to face, but in addition to that, we deal with systemic things that continue to perpetuate, those things that are subtly oppressive to us. Again, the economic piece. Okay, so we have to deal with so many different layers that are just, it's like the cards are kind of stacked against us. So we have to press a little bit harder. And I'm not surprised. But again, we still need to recognize those things and be sure that we're aware of it and make the necessary steps to get the mental health support so that we can cope in this society that right now seem to make decisions that are not in our favor.
Very good point. Very good point.
Tarika?
Anybody else want to weigh in on that?
Tarika's trying to speak. You have to unmute.
Go ahead, Tarika.
I don't get to do that. Thank you. So I'm glad that we mentioned that. There's just two PSAs that I want to mention in regards to how the diet is correlating to the mental health as well. And it's something that's so simple that we just never really thought about it in this context. One, individuals that are dealing with hormone disorders, any type of mental illness like bipolar, that has to deal with alterations of the central nervous system, depression, and various other factors is coming from the consumption of bread, wheat. Now, how do I know that to be factual? Before I started this journey, I would go into manic depression moments just out of the blue. And I would be completely depressed in the bed 3 days in the dark. And this is at the point when I was pretty much fairly over 300 pounds was normal for me. And I'm 5'4". And I would go through these manic depression moments. And I also was diagnosed with PCOS, which is polycystic ovarian syndrome. So at one point in my adulthood life at 37, I woke up and my eyes were swollen like blowfish. And I was going to the doctors, and the doctors could not tell me what was going on with my eyes. So I proceeded to do the research on my own, came across a book called Wheat Belly. Wheat Belly then explains how the alteration of wheat changed in the 1950s, 60s. When you grow normal wheat, wheat grows very tall. It's very hard to pull the kernels off of the top of the stalk. So it would not have been cost effective for farmers to farm wheat and provide that to the population of people. So there was a scientist that grew a wheat that is called dwarf wheat. And this wheat grows short, and the kernels fall off of the top of the stalk. So back in our days, when you were told to don't eat white rice, eat brown rice. Don't eat white bread, eat brown bread. This was the push when they discovered the dwarf wheat and created a synthetic wheat that they can make as much as they want. It wouldn't run out, and it was more affordable as far as the farmers are concerned when it comes to providing the resource to the economy. So therefore, no one tested how this wheat will be detrimental to the human body. So this doctor did change all of his whites to wheat, but never noticed any changes to the conditions of his body. So he further tested the wheat and found that there's 14 different chromosomes in this dwarf wheat that no one tested to see how that would affect the human body.
So how did it affect the human body?
Well, what's happening is it does alter your central nervous system. It does causes you to be overwhelmingly depressed, especially if your hormones levels are unbalanced. And for example, with myself, I had PCOS, where my body was producing an extreme amount of estrogen and not catching up with the other hormones levels that it was needed. So not to be personal, but I want to be clear and very candid, my menstruals would come on, and at one time it stayed on for 6 months every day. So I had never had a normal menstrual my entire adulthood life. Until I read this book on January 1st, 2014, I finished the book, closed it, and eliminated all wheat from my diet. And my body corrected itself in 90 days.
Very good.
So I further tested that through experience. I traveled to Spain. And in Spain, I noticed that there was no bread in a bag. You had to go in a separate room where the bread was in a dark room in an oven. And I ate the bread and I had no reactions. But when I returned home, I just wanted to test and see. And I ate the bread and it immediately felt the tingling on my eyelid. So at that point, I knew that something was going on with the wheat and furthered my research. Now, with that, I also learned in Wheat Belly, there was a mental ward where they also tested the consumption of wheat and what that was doing to people. So in this particular, ward, they removed all wheat from the patient's diets, and there was no outbreaks. There were no manic depressions. All the patients were fine. They were so astonished by the results, so they put the wheat back in the diet, and surely the patients began to act out again. Wow. So they repeated this method several times. And the same things that were explained in this book is the same thing that I experienced in my life. Now, as you go on through this transition, even for myself, of course, I've eaten a little wheat going, as time has gone by, just cheating or just going through a binge, because these things have chemicals in it that makes you crave more of it. It does not satisfy the body. So this is why you have to eat again in 2 or 3 hours and eat again and again. So you're craving it and you become attached to it. So even after I've transitioned my life and went back to eating wheat and experienced the crave, the weight returned, the fatigue returned, but my hormone balance have remained the same. So you then have to make sure that you're staying in place. So just the consumption of wheat, if you're dealing with any type of hormone issue, any type of bipolar or any mental consumption, mental issue, the first thing you want to do is eliminate wheat from the diet.
Got it. What about Belinda Jones? Do you have any comment with regards to the challenges in terms of mental health that we're confronted with, and any personal stories or that you might be able to tell us? We know that you come in contact with the community all the time. Belinda? Don't know. Hello? What Belinda, can you hear you?
What was the question?
I was just asking with regard to
what was the question?
Mental health and the challenges confronted by people in the Black community. What do you see out there when you come into contact with so many people in your Healthy Start program?
Well, currently a lot of the moms don't have insurance. So they suffer from a lot of mental health issues and things like that, bipolar, schizophrenia, anxiety, depression, and don't have funding or medication to, get the help that they need. So we try to work on getting them insurance and finding clinics so that they can get health insurance and things like that. A lot of it has to do with just funding. It's just not enough funding, out there to help people with the mental illness. A lot of people are ashamed, of that they have it and really don't discuss it, especially Black African American. So we just ignore it. But now we have celebrities coming out and everybody openly discussing it and everything.
Right.
So now it became a real, a reality that, this is real. Not only you might be rich and everything, you have everything, money, fame, but at the end of the day, the suicide rate has gone up and has increased. So, that's another thing that's really big out here is suicide. So, we have like the suicide prevention, and I'm experiencing my mom. I know that, hey, I'm here for you. You contact me. If you need me, you're not alone. So that's the big thing right now with everything. And so, it's not enough funding. The substance abuse out here is just crazy. You got to kind of, all you can do, like I say, if you can just save one, you can't save everybody. It's all about the funding. And it's not enough resources and material and education for us, So that's why, the suicide rate is going up, and it's the depression. People just don't know what else to do. And they think ending their life is just the best way to go out.
You mentioned several good points, Ms. Jones, especially as it relates to the suicide rate, the lack of funding. Also, we're sure a lot of this has to do with lack of access to appropriate mental health care help. We know that that's also having a negative impact. Go ahead. You raised your hand, Mr. Todd. What do you have to offer us?
I just wanted to follow up on, once again, I'm coming to your restaurant, on the wheat belly, because I read the same book. And in that book, you understand that there is nothing in what we call wheat now that resembles wheat. It is all processed, all set up to make profits off of this stuff. It's all set up to make it last as long as it can on the shelf. It's all set up with chemicals to help make that happen. And we have to be very aware of walking around in our grocery stores. I was told many, many years ago, if you go in a grocery store, shop around the edges of the grocery store, not down the aisles, because everything down the aisles is processed. You got an aisle of, I can't imagine a whole aisle of cereals that are just tearing our kids' digestive systems to pieces. Two things. Now let somebody else speak. There are two people that African Americans really need to get online and see videos. Dr. Sebi and Dr. Joy Leary. And I'm saying those two names because when it comes to our mental health, and I'm just going to tell you my own personal story, my own personal travels with that. My mother suffered from paranoid schizophrenia. And so there were spinoffs in my family. My sister's, one of her children developed that and eventually died. My niece's son is severely autistic, can't speak. Okay, I suffer from depression. And then I started to find out about my own family history. Okay, So that made me very cognizant of what I needed to do to stay healthy. And I explained to my son early on, there's certain things you can't do because your body and your mind are prone to be addicted and to have a psychotic break if you do certain things and put certain things in your body. Okay, I have two brothers who became addicted to drugs. They were on the streets. They got into the world, and they're gone. And so we have to understand, you know, as Malcolm said, we are living in a time of, for a lot of people, destitution, depression, hopelessness, and those feelings manifest themselves in depression.
Yeah.
And you have to be, the doctor that you go to see, if you have a primary doctor, has to be well aware of that and how that affects African Americans. It comes out in body pains, okay? It comes out in sadness. It comes out in anger and frustration, okay? Because of all the things that we're talking about.
Yes.
When the budget that you're talking about, Ben, was presented, I asked the city council over the past 50 years, how come the community has been denied these needs, these services? And I just asked them a question, why? And not one of them could answer. So you see, what we're dealing with is a systemic problem that dates back to our forced enslavement in this country. Okay, and we have been denied the rights that should have been afforded to us for healthy being, physically and mentally, decent housing, decent jobs, decent education, decent schools, and a decent environment. And all those things that have been put together that are negative have been negatively affecting us for 500 years.
Let me add this, Welton. We know that prejudice, racism that is inherent in the daily environment of Black people plays a role. Now, Ms. Leitner, you're confronted with people who have all kinds of mental health challenges. A couple of things I'd like to accomplish before we get off. And that is, what are some of the problems that we're having to deal with, or our children are having to deal with, Ms. Leitner? If you could talk about that for a few minutes before we get off.
Yes, that's a great question, because our children are definitely suffering with a lot of anxiety, a lot of stress. You know, we have a lot of parents who contact us, our organization, to get their children evaluated. And after that initial evaluation with our licensed clinical psychologist, we see a trend of anxiety, and not just anxiety, but on top of that, I think that was you, Wells, that mentioned the physical symptoms. A lot of it manifests in physical symptoms. So the parents will come to us and say, well, we've already taken them to the pediatrician for several tests. They're complaining of stomach aches. They're complaining of headaches. They're complaining, I can't go to school, when it's actuality a mental health issue. Their minds aren't healthy. They are emotionally unregulated. And they are, again, distressed in their social relationships. It affects their social relationships and affects their ability to even learn and complete their academics. Sometimes the stress is just so heavy that they can't focus. So then parents are telling us, well, they're failing. They were doing well, you know, a few years ago, and we don't understand what has happened. So their environments, the effects of social media, the lack of enough resources, all of that combined just creates this pressure and this stress that we just don't know how to cope. And we need to access, if you have Medicaid, if you have that one resource, Medicaid does cover mental health services. And we as a community have got to break this stigma and take that step to go get an evaluation, and we don't even just service the child. If we have children that we are servicing, the parent has to be involved because you are directly relating to that child, and there are some strategies that you need to have in order to help the child and even yourself, because you may not even know as the parent, you could be the one perpetuating what's going on because of your own issues. So we all need to address that, even as a parent, become healthy in your mind and physically so that you can be better for your children and be a better model for them as well.
Listen, we've got to talk about that stigma. And we got to be upfront. We can't have inhibitions, reservations, and hesitation about addressing it. That's the white elephant in the Black community with regard to mental health. And that is the whole issue of stigma. Wells Todd, I admire you for your strength with regards to your talking about depression in your own life. Of course, most people know about me that I've been through major bouts of substance abuse. But we've got to get over the stigma, because you can't begin to deal with the problem if you're not honest about it. In the words of a very good friend of mine, the fact of the matter is we're all recovering from something. We don't know what your particular problem was, but I assure you that everybody here on this panel had some kind of issue and needed some kind of help and sought it in more than one occasion. I can remember sitting on the side of my bed and crying out to God for help as my mother cried out for help right beside me. Folks, we know that some of you are going through some issues. We know what it's like in families, people having arguments, fussing and fighting, and it's no sense of us acting as if it doesn't exist. The bottom line here is we've got to push that whole issue of the stigma away. Before you get away, I want each of you to tell us how we can get in contact with you. We've had many questions here on the chat. People want to know how to reach out to you. And I want you to take about 30 seconds or so, not longer than that, to tell us how to reach you. Well, Todd, go ahead.
Well, I'm retired, so you can reach me directly through my phone number or my email address, and I can give you that. My phone number is 904-477-8979, and my email address is wellstodd625@gmail.com.
Thank you very much. And Ms. Leitner, how do we reach you?
Yes, you can reach Harvest Mental Health Services at 904-595-6516 or visit harvestinterventions.com.
Very good. And Miss Belinda Jones, how do we reach out to you?
Yes, you can reach me at belinda.jones@floridahealth.gov, and my contact number is 904-253-1113.
Very good. And of course, Miss Tarika Nelson at the Teapot. We got to get by that restaurant, Wells, and see what they're cooking up over there. How do we reach out to you, Tarika?
Absolutely. We most certainly welcome you home at 1818 North Davis Street, Jacksonville, Florida, or directly across from McDonald's, right before you get to Shands. You can follow us on all social media platforms, which is T Posh Naturals, both Instagram and Facebook. And also you can visit our website at www.tposhnaturals.com. So we look forward to seeing you home.
Hey, listen, this has been rather stimulating. I certainly do appreciate each and every one of you for appearing on this program. Your health matters. So then, given that the Black community exists at the intersection of racism, classism, and health inequity, their mental health needs are often exacerbated and amplified. Issues that are related to economic insecurity and, of course, the associated experiences such as violence and criminal injustice. They further serve to compound the mental health disparities in the Black population. The health disparities between Blacks and whites are profound and horrendous, if not ludicrous. They are so easily traceable to policies, practices, and procedures and systems that are all rooted in racism, discrimination, injustice, and the ideals and ideology of white supremacy. We must all work together, folks, to change that for the better and for the greater good of us all. I'd like to thank our online audience for joining us today. We'd also like to thank our panel members for a very interesting, illuminating, and provocative discussion. Our focus today has been Your Health Matters. And don't you dare forget that either. Our thanks to Clear Health Alliance and for the support of Florida Blue and for all that they do for the greater Jacksonville community. Folks, you got to start working on you. You want to live longer? You got to eat better. And just remember, we told you here that your health matters. We are here to tell you your health matters. Northside Coalition of Jacksonville, we're on your side and on the move. Thanks for joining.
That's your
That's your menu.
Yes. And we do have some of Dr. Sabi's Alkaline options available.
All right.
Very good.
And you, as soon as you walk in the door, you're going to see Dr. Sabi first.
Very good. Thank you again. And we thank our producer, Mike Todd. Roll it.
Our appreciation to members of the Northside Coalition of Jacksonville, members of its board, staff, supporters, and volunteers. Office Manager, Courtney Booker. Also, to members of the NCOJ Steering Committee, and to our many members, supporters, and volunteers. This program was produced in collaboration with the New Florida Majority. Our director and producer was Mike Todd. The Northside Coalition of Jacksonville. We're on your side and on the move.